Welcome and thank you for joining this morning. My name is Sarah Anderson, and I'm honored to serve as Executive Director of the Bay Area Global Health Alliance. We're a global health community with now more than 60 member organizations from academic institutions, NGOs, nonprofits, tech, biotech, and other private sector companies. All of us are committed to working together, building connections across the sectors, and sharing knowledge to advance global health equity and innovation. We are very pleased to host an interesting discussion this morning on current African market trends and innovative digital distribution of health products. And the reason for it is to improve access and empower consumers, and to learn what we as global health stakeholders can do to support locally led development and innovation. Salient Advisory's new market intelligence report is the focus of this talk. Salient's Director for Africa, Remi Adeseun, and their engagement manager, Dunni Lawal, will present their findings. Martin Dale, PSI's Director of Digital Health Monitoring, and I'm very pleased to say a very new Bay Area Global Health Alliance board member, will be your moderator. Before I turn it over to them, I want to go over a few housekeeping details. If you haven't done so already, please rename yourself and list your name and organization at the bottom of your Zoom box. And feel free to introduce yourself in the chat. This is technically a webinar, not a webinar, but a Zoom meeting, so that we can have more interaction. Please also put your comments and questions in the chat, and we will have a short audience Q&A at the end. And without further ado, let me please turn this program over to Dunni. Dunni?
Thank you very much, Sarah, for the introduction. So I would start by sharing my presentation slides. Just give me a minute to do that. Okay, perfect. So this presentation is going to take us about 15 minutes. So once again, thank you, Sarah, and welcome everyone to this session where I'll be sharing highlights from 2022 report on innovations in digitizing health product distribution. So I'll start with an executive summary and then provide a brief overview of the project background, share our key findings and recommendations from the report. So starting quickly with key highlights, this year, more than 80 companies feature in our report compared to the 61 companies that were included last year. And most of the companies we track operate in Nigeria. Regarding service categories, this remains the same. Innovators are either digitizing distribution to providers or digitizing distribution to consumers, or they offer product data services. Looking at particularly the innovators digitizing distribution to providers, one key thing we noticed this year is that this group of innovators are growing in terms of the numbers served and also reporting stronger user retention numbers. And what we see is that this trend echoes the growth trends we see in the larger or the broader B2B marketplace in the African tech ecosystem. Lastly, I'll touch on funding. The good news here is that innovators are raising funding, starting to raise more funds. However, there are some exclusionary trends that we see in funding, and particularly Black founders and women founders continue to remain sidelined. But a positive trend we see this year is the increase in activity from what we call Africa-led investors. So moving on, I would provide a quick overview of our background of the project. So start off, it is key to note that this report is part of a longitudinal study. We started this project or started tracking this ecosystem in 2018. And the two primary objectives of our report is to first to describe the ecosystem of innovators that are digitizing health product distribution, and also to highlight emerging trends from these 4 focus countries. Second, we also always like to highlight how global change makers and stakeholders can accelerate the impact and scale of these high potential innovators. In terms of project scope, our report focuses on companies that are working to improve the movement of health product distribution from the point of local manufacture or clearance at the ports to the point of dispensation. It's key to note that we do not include companies that solely focus on the distribution of consumables, medical devices, and telemedicine efforts that do not facilitate product delivery. Regarding our approach, this started with an ecosystem landscaping as well as a review of our internal health tech database of over 1,200 companies. This landscape identified about half of the health tech companies we had as a potential fit for the project, and further data screening revealed 83 companies that were included in the data collection process. So this year, we also met with industry stakeholders and regulators in the focus countries to understand the impact of innovators on the market distribution structure and critical gaps that innovators may be able to address. So let's quickly delve deeper into our findings. So starting with the fact that 83 companies were featured in this year's report, and this represents almost 200% growth when compared to the 28 companies that were included in 2018 when we started tracking this space. Nigeria remains the largest hub of innovation amongst the focus countries, and 58% of the innovators we track are active in this space. Compared to previous years, the rate of new entrants in the ecosystem seems to be slowing down, as we only recorded 4 new startups being founded in 2021, compared to 15 companies that we had in 2020. And lastly, key to note is that while not new companies themselves, retail pharmacy chains on the continent are entrants into this new ecosystem of digitized distribution, having launched online pharmacies in a pursuit of what we will call an omni-channel strategy. The innovators offer 3 main types, the services they offer fall into 3 main categories. So innovators focused on digitizing distribution to providers, improve the stocking, the financing and distribution of health products to clinics, pharmacies, and hospitals, while those serving consumers proudly allow consumers to be able to locate products and request delivery for products via digital platforms. Lastly, product data innovators enable consumers, manufacturers, and governments verify the genuineness of their products and also offer track and trace services. It's key to note that innovators continue to offer a blend of services, and about 33% of innovators fall into this category. And the most common blend of service is the combination of innovators digitizing distribution to providers and consumers. So as a result of this, trying to fit innovators into one category can be difficult as innovators continue to redefine their operations. Doing a deep dive into the category of innovators digitizing distribution to providers, they appear to be growing and have a stronger user retention rate. This year, innovators such as Life Stores and Shelf Life stood out by registering impressive growth. When we look at the customer retention rate at 46%, this is higher compared to the category of those that digitize distribution to consumers. And what we see is that this growth trend, it mirrors what the trends we observed in the African tech ecosystem, where B2B platforms that serve informal retail shops are growing and raising funds. And what we've noticed that the biggest winners in this category are platforms that serve not only informal retail shops, but those that offer working capital solutions such as buy now, pay later options. In our research, 31% of innovators fall into this category and offer working capital solutions. What we recommend is that as the ecosystem evolves, tracking the financing solutions by this group of innovators will be vital, since this appears to be a strong value proposition for them. Looking at innovators that digitize distribution to consumers, 81% of our innovators fall into this group, and this makes it the most popular service offering. We identify or we classify the innovators into 4 types in this space: digital first startups, single outlet pharmacies with new digital channels, retail pharmacy chains, and e-commerce giants. Regarding the scale of operations, this remains small except for e-commerce giants that have large operations. Additionally, the scale of impact on health product distribution for all companies is small, since they have low active user numbers, and also because they face various challenges, such as restrictive regulations that do not allow e-pharmacy outlets distribute prescription medicines. So for them, their distribution is limited to OTC and wellness products. So for this category, what we see is that each type of business is limited by different factors, which explains why we are not yet seeing an impact on product distribution. For the third category, these are product data service providers, and few innovators offer this service. And most of the companies in this category are in the growth and mature phase and will have well-established multi-country operations. Generally, this is because the barrier to entry for this for this category of innovators is high, as they require a lot of funding to be able to develop the technology required for these service areas. So most of the innovators in this category offer services to either identify counterfeit drugs or also provide track and trace services. And in fact, most of these innovators offer both services. Overall, for this group of innovators, what we see is that policies that support product authentication at national levels are needed to maintain and support growth in this space. I will move on to sharing some insights on regulation. The headline here is that we've seen significant progress over the past 12 months. So Nigeria and Ghana have launched online pharmacy regulations, while in Kenya and Uganda, these regulations are still in development. What we see is that these early days of developing and implementing regulation is key, because we understand, as we would expect, that regulations will shape the structure of the ecosystem for future years to come. And an example of how this regulation is starting to impact operations is that in all our focus countries, the regulators require online pharmacy operators to have physical pharmacy outlets. Already, what this means that digital first and digital only startups will now need to start considering either building physical locations, acquiring or partnering with a licensed physical pharmacy just to be able to continue operations. So it's key to note that while regulation is taking shape, efforts will be required to ensure that innovation continues to, regulations continue to remain innovation friendly, and it continues to support the work that innovators are doing. I'll move on to share some funding related insights. Let's start with the fact that the investment momentum in the ecosystem is strong. 36% of all the funding raised by innovators came in the last 12 months. So majority of this funding is in the form of equity rather than debt or grants. And this for us is a sign that commercial investors are actually interested in this space. But one red flag we would like to highlight is that funding is also highly concentrated, and 72% of the funding that was raised in the last 12 months went to just 4 companies. The risk here, in our opinion, is that concentration of funding in high-profile companies that are very popular may result in gaps in the ecosystem. So that as investment increases, there's a need for systemic approaches that will be required to ensure seed and early-stage funding is provided to new companies or nascent innovators as well. So still on funding, and then looking at the exclusionary trends I mentioned earlier, this still remains prominent in the ecosystems that we track. So 56% of all companies that raised funding in the last 12 months had all Black founding teams. However, they were only able to raise 13% of total funding. In comparison, companies with white founders raised 28% of total funding, while 59% went to startups with mixed race founding teams. It's also key to note that because of this trend of exclusionary funding, local founders are starting to make early pragmatic decisions early on in their company founding phase in terms of which team members or which individuals make up their founding team. So speaking to one of the innovators, it specifically told us that he sought out a foreign co-founder from a high-income country to improve his company's chances of getting investments in the future and when required. Lastly, on this slide, we'd like to highlight the trend of exclusionary funding, and we see that this is most evident at the intersection of race and gender, and specifically, Black women founders continue to be sidelined, and they were able to raise only 2% of funding in the last 12 months. Finally, on funding, 58% of innovators that raised funding in the last 12 months cite Africa-led investors as a source of funding, as there's been a significant increase in the number of African-led investors in this space. So we define African-led investors as venture capital firms and angel syndicates and investors, or even financial institutions that are not only based on the continent, but are also led by Africans. We admit that, yes, while there's been an uptick in the activity of Africa-led investors, the actual amounts raised from these sources are unspecified, as innovators in most cases decline to provide this information. But I think the key thing to note here is that the voices of Africa-led investors are vital in the ecosystems because they are likely to understand and they are more familiar with critical operating factors in local markets. Lastly, I'll share some insights relating to public health impact. Our research showed that only 43% of innovators reported affordability as an area of impact when compared with 94% which reported product availability. And for those who reported affordability as an impact area, there was very limited evidence to support the claims, and only 2 of our innovators, MyShaMed and Maidawa, were able to share examples of clear work where they've done to work they've done to assess their impact in this space. Overall, our key takeaway is that impacting or competing on affordability is not yet being prioritized by innovators. Instead, innovators mentioned that making quality products available is a strong enough value proposition for them without needing to reduce prices. I will quickly touch on our recommendations. So following our work, we've developed actionable recommendations for health stakeholders as we continue to advocate for innovators. The first is that there's a clear need to partner with and invest in innovators that have transformative potential. Our research shows that innovators are achieving product market fit, and so providing funding and facilitating further access to market is critical. Second, because demand from public purchasers is key, we're advocating that purchasers such as donors, donor-funded agencies, and governments and industry actors need to articulate the type of digitally enabled distribution services they require, as this will help innovators further fine-tune their services. Regarding regulation, we are advocating for the establishment of a multi-country regulatory working group. Our belief is that such a group can provide demand-driven technical assistance to support the regulators in focused countries as they develop regulations for online pharmacies and also related services such as telemedicine. Fourth, regarding improving supply chain visibility, we're recommending support for leading governments to test the aggregation of global, local, and regional supply chain data, especially by building pharmaceutical data platforms. We feel that when this is successfully done, aggregation can be leveraged to inform public health supply chain planning and to ensure broader visibility of supply chain data as well. And lastly, we feel that stakeholders can test if and see how early stage digital payment innovations can facilitate the engagement of pharmacists in the delivery of primary care. So even though these digital payments innovations offering are generally at an early stage, there's an opportunity to study them and better understand how they can facilitate the effective engagement of pharmacy providers and their inclusion in primary care systems. So thank you for listening. I would hand over back to Martin.
Thank you so much, Dunni. Yeah, this is a fantastic and in-depth report. And I think it's going to be really useful for different sector players. So I have the pleasure of asking you a few questions regarding the report. So I'm going to try and go into a few areas that you highlighted in the presentation, and then maybe we can get some further reactions from you for each of these areas. So yeah, let me kick off with a question regarding market growth, particularly around digitized distribution of health. So what do you see is either driving or hindering the growth in the 4 countries that you landscaped? Is there anything that sort of came to mind?
Yeah, thanks very much, Martin, and hello to everyone on the call. One of the things we found very interesting, first, some context, we've been covering this space in the last 5 years, starting from 2018. So we found the growth to have been simply explosive. The first report we published in 2018 had barely over 20 innovators. Fast forward to the 2022 report, that growth has been more than 200%, featuring now well over 80 innovators. But one particular spike we saw was during the period of the high intensity of COVID. So that lockdown period really brought out the creative juice and empowered those who already had ideas to improve access, because people simply couldn't move around, just as they wished. So COVID was a major driver or accelerator of that. But the more interesting thing is the various value propositions, the unique value propositions, the problems these innovators are solving. They're solving problems not just of price, as Dunni said, and I'll come to that in impact later, but they're solving problems including rural access. So if we look at the value proposition, it ranges from those who are servicing consumers, so product locators you can have on your phone and app of an innovator, and you can tell where you can find which medicine. You can do cost comparisons, and all of these things that have been powered by e-commerce is also being adopted in the online access to medicines. Lastly, investment has been, just to keep it short to about 3, investment has been a major driver. As Dunni said, funding in this sector is second only perhaps to the fintech area. So there's been quite some significant improvements in funding, and particularly impressive is that funding coming from commercial equity investors is outstripping funding coming from grants in particular. So it's becoming attractive to even those whose motivation is economic and financial. So if we look to the constraints, one of the most often cited constraints in this space is that of regulation. So as we'll expect, innovation precedes regulation, so that's understandable. But when there's ambiguity, where there's doubt, investors are willing to go. So for a long time, just about 8% of African countries had any form of regulation, Rwanda being one of the early ones. And we reported last year, but recently there's been progress there. So Nigeria and Ghana, for instance, have published online regulations. Kenya, Uganda also have theirs in the works. So the more that comes on stream and becomes investment friendly, the better. And lastly, the last mile logistics. That's been a major hindrance, because you do the fulfillment, the marketplace, and all the other tech-enabled solutions. The physical product still has to reach the end user. So that last mile logistics is a major challenge. So building the infrastructure is beyond the scope of just supply chain. It involves government as well, improving the roads and all of that, even though you have drone manufacturers and drone service providers bridging some of that also with tech. So those are some of the drivers and hindrances we observe.
Fantastic. Those are great insights on both the side of drivers and hindrances. So I wanted to ask a question regarding the regulatory framework, because this is something you mentioned. So to what extent are the regulations that you're seeing being established creating a supportive environment or a restrictive environment with regards to the market thriving?
Okay, Remi, I'll answer that. Thank you, Martin, for that. So just starting off with where Remi stopped, in this case or on the continent, the regulators are in what we see are starting to play catch up to what the innovators are doing. So if we look at how restrictive it is, the first thing that comes to mind is the point I raised earlier regarding the requirement for online pharmacy operators to all have a physical location. So what this does is that it only covers a class of online pharmacy operators, which is simply the companies, existing pharmacies or traditional pharmacies that are starting to add on digital channels or platforms to their operations. There is no consideration for digital first companies or even product aggregators that act as middlemen between manufacturers and the dispensers that do not actually lay hands or touch actual physical products. So those regulations are restrictive in that area. And one of the things we're starting to see is the need to engage regulators to actually start to accommodate these different types of innovators as they come up with, as they further fine tune the regulations. And to flip it on the other side regarding how supportive regulators or supportive regulations are, based on our interaction with the regulators, I think the key thread that comes out is the fact that they acknowledge the need for these innovations and the work of the innovators and their impact on public health. And they are embracing the knowledge which these innovators bring to the ecosystem. So if not all the countries we track, the development of the regulations at some point involved feedback or interactions with these innovators. So the regulators are starting to see the importance of bringing the innovators to the table as they start to define this regulation and as they further fine tune and also develop regulations for adjacent ecosystems such as telemedicine. So I think it's a key area to watch. By the end of the year, we hope significant progress will have been made, and obviously we'll track this in the next edition of our report.
Fantastic, and it's good to hear that they're bringing innovators to the table, because I think that's the right move in order to shape the regulations in a way that will make the market thrive. Moving on to funding, the issue of funding. So you mentioned a lot about the spread of the type of funding and also the source of funding within your presentation. But could you maybe touch on it again, just so that we totally understand what that situation is? And then maybe in particular, talking about the opportunities for expansion based on your findings.
Okay, so thank you for that, Mark. I think just to reiterate, equity and grant fundings were the most common sources of funding for innovators, and about 25% of, just about a quarter of growth and mature stage innovators report both sources as a source of funding. Debt is the least common, and this year I think the major innovator that raised debt funding was Good Life Pharmacy in Kenya, and they raised about $12 million from debt financing from Propaco. So for the most part, debt funding is still limited. Regarding the sources, in addition to the Africa-led investors we've cited or highlighted, funding sources also ranges from investment grants by some large institutional donors such as the Bill and Melinda Gates Foundation. We have seen some investments from USAID, and we also have smaller individual investors, angel investors, putting their personal funds into these companies. We also have small Africa-led investors such as the Toli Elumelu Foundation and CCUp, which is an accelerator on the continent. So this group of investors are starting to see the potential of these companies and putting their money there. Regarding your other question, which was, I think, the opportunities for expansion, yes. Beyond equity grants or say debt type of funding, we feel that they can be targeted funding by stakeholders in this group. And this can also be areas regarding operating research. So there are recommendations that innovators need to continuously test and validate the efficiency or the effectiveness of their operating models. We think this is an area of expansion. We've recommended studies in terms of tracking the impact of innovators on public health. We feel like global health stakeholders can also fund these studies going forward.
All right, fantastic, great. So moving on to the matter of impact. So if digitization was to yield the cost savings and the improvements in affordability for products, this would be the best differentiator in order for this market to really thrive. So could you mention a bit about your findings relating to impact on affordability, and give us your thoughts on whether this hypothesis could be realized eventually? So are we going to see this as the differentiator?
Thanks, Martin. I think you're spot on, because when innovation comes into an industry, one of the things to expect is a change in the structure of that industry. So the ingoing hypothesis in the health product distribution, supply chain, and the innovations coming in was that there will be a disintermediation, shortening the multiple layers, especially in Africa, from the manufacturer or the point of import till the point of dispensation. Now, that will require strong relationships with the big pharma and the big importers that control that supply chain. And that hasn't happened much. So if you've not had much disintermediation, then it means the impact on price will be much less. So what have the innovators done? As they're building their capital base and building their negotiating power with the manufacturers, they focused on more inefficient aspect of the supply chain, which is that of at the wholesaler level and closer to the consumer. So you see that re-intermediation is what's happening more than disintermediation. They're setting up tech-enabled platforms that allow the user to just shop on their app without having to go from pharmacy to pharmacy to find out where the products can be found. So they're saying that the value proposition that the user gets in terms of convenience and other benefits is for now more than what they can attempt to negotiate upstream. But an example where that disintermediation is happening and where we need to see more of it is like the MyDawa. If many may have heard of the Macuban example in the US, where it's dealing straight with manufacturers and has brought down prices significantly. MyDawa is doing a similar thing, working with a group of manufacturers and going direct to the users through their consumer-facing applications. But the majority are in re-intermediation space more than this intermediation that leads to affordability gains.
Great, thank you. That's a great response. And you mentioned convenience, so it will be interesting to see how convenience can actually be seen as a strong enough differentiator, even over and above affordability, because it is a good point. Time is money as well for our consumers. Right, so the report also pointed out imbalances when it comes to the proportion of women and Black founders, and particularly in relation to accessing funding. So do you have any recommendations on how this situation can be improved by stakeholders in the sector?
Thank you for that question, Martin. I think for both groups of marginalized, groups that we highlight in our report, which is women founders and Black founders without ties to high-income countries, the existing biases need to be removed, be it race or gender. And we can only do this by implementing directed and targeted investment efforts at these marginalized groups. So specifically for when we look at women founders, in addition to whatever barriers they face, we think it is key to understand what these barriers are, why they face these barriers, and ask those questions. And this will enable us to develop those investments or targeted investment efforts that would solve the problem. We feel like a blanket approach isn't going to solve it specifically for African women founders. So questions around like what biases are actually preventing them from starting businesses or operating businesses in this ecosystem, or barriers why do we have very few sole women founders in the ecosystem? Those questions need to be asked, and we need to be able to come up with targeted solutions for those barriers before we then now start to seek targeted investment efforts at this group of people. Remi, do you want to add any comments on the I3 program?
I think you covered it more. I was instead responding to Obiora, whose question was on, did we see any slowing down as the space begins to open up, from the pandemic, effects of the pandemic, normalcy. And spot on. And I know Obiora Ofuegu is the supply chain director at Sanofi. And that was actually part of our finding, that in the year under review, which was from beginning of 2022 to June, only 4 new entrants came into the space. Significant slowdown compared to the previous periods, where we were having double-digit, growth. And this is not isolated or peculiar. Also in the US and in other parts, telemedicine use, for instance, dropped as the space opened up and people were no longer bound. But the increases that had been achieved are still being maintained. It's just a question of a slower rate of growth in terms of new entrants. So I hope that answers your question, Obiora. And I think there's some, yeah, sorry. Before I jump into Martin's job of moderating.
No worries, and thanks for keeping the question Q&A moving. So I've actually got just one more question, and this is more of a selfish question coming in from the board of the Bay Area Global Health Alliance. So is there any way the Bay Area Global Health Alliance community can be more involved in advancing locally led innovation, particularly in this area, the area of digitized distribution of health products?
Fantastic, Martin, and thanks to you, board member of Bay Area Global Health Alliance, and Sarah and Colin, who helped to facilitate this. In fact, we are so enthused by your membership, the quality, the caliber, and that leads me back to the Investing in Innovation program that the Gates Foundation is currently funding. One of the things we think the Bay Area Alliance can help with is in convening additional sponsors, right? Providing that platform to contribute to the pot. 60 odd innovators to be supported over 2 years is great, but it's a drop in the ocean compared to what's possible. So increasing that pool of funding to join the foundation, Gates Foundation, will be very helpful. We have industry co-sponsors open. We have co-sponsorship open in the area of providing technical assistance. And these are some of the areas where your members excel. I see my good friend and former colleague, Eddie Gillison, is on the call, IQ there. So these are giants who have a lot that they can contribute to the work of investing in innovation in kind or through some direct, sponsorship. So those are some of the things we think your members will be able to add value to.
Fantastic, and thanks for the response. And I'm sure this is something Sarah, our director, is going to try and take forward with the Alliance. So yeah, that's more than enough from me. So maybe we can take some questions from the audience as well. So maybe kicking off with Margot, who's an Alliance member with Medicines 360. So Margot, do you mind maybe coming off mute and putting your camera on? And you can go ahead and ask the question.
All right, thank you, Martin. Thank you so much, Dunni and Remi. This has been a fascinating conversation. I'm Margot Flanastock. Medicines 360 has an intrauterine device on the market in the US and also in Ghana, Uganda, and Kenya, or excuse me, Uganda, Kenya, Nigeria, not Ghana yet. So this has been super interesting information. I'm curious, you've already touched on some of the equity questions in the funding space, and I mean equity in terms of fairness. What about who you think might be left out of these digitized solutions? You mentioned that there was one company opportunistically, it's Francophone, that you included. I'm curious about geography in terms of where the innovation's happening, and maybe just specific populations that you think could be left behind that we as a community need to really think about now while this innovation is taking off. Thank you.
Thank you very much, Margot, for that question. The equity issue is real, and in the countries where we focus on, there is already existing challenges, even with the traditional models, just for the fact that literacy rates lag well behind the global standards in terms of percentage of literates. I think is about 90% globally, and in Africa, you have like 70% literacy rates, and in some countries even lower than that. What that already means in the standard traditional service delivery is that some people are cut off because of communication and ability to understand. And that will get worsened, of course, when you're talking about tech. If you look at the phone penetration, one of the things that we think is both an obstacle, but itself is turning into an opportunity, is the rapid rise in phone ownership on the continent. So that's helping to bridge that gap. And when you see some of the innovators who are designing for feature phones, not just smartphones, using things like USSD to provide access to information and linkages to products like Zuri Health and C-Stock, for instance, which is from the GSI offshoot. So you see that the innovators are conscious of that, and they are also developing models that are agent-led. And this I will combine with another question I saw on the chat, about, you know, how are we seeing the evolution of digital channels plus the brick and mortar. That there is a lot of that coming together, right? So when you have agent-led approach, so e-commerce companies like Copia, who do some health products, and healthy entrepreneurs, which very fantastic company in East Africa focuses exclusively on rural area. So what they do is that is the agent that is equipped with a device and is based within the community, helps in formulating both the orders and also helps with the delivery. So those are some of the ways that, you know, organizations are helping to ensure no one is left behind. But this is where the final point I want to make is still important. It takes risk tolerant capital, right, to allow for more deployment into, especially like the rural areas where the digital skills and devices are limited, and where also even the affordability, the purchasing power is low. So such, you know, risk tolerant grants allow for more, you know, solutions to be deployed to those lower socioeconomic ladders to make sure no one is left behind.
Thank you, Remi. Great.
Thanks.
I see Chelsea has a question. So,
yes, I was actually going to ask Ben first from Navy. So Ben, do you mind coming on camera and asking your question?
Yeah, no, great. Great
and
panel.
Good to see you.
Good to see you.
Long time.
Well done. Moderating and a great panel here, everybody. I'm really glad to be able to follow it today. Actually got it through the PSI newsletter this morning, so quickly signed up. I saw on one of the slides mentioned that there are relatively few data sales taking place yet. And of course, as we digitize, data becomes both the product and the byproduct of so much of what we're all engaged in this digital space. I'm curious, with IQVIA on the call and others, what are the opportunities you see going forward for data as the product, data as, you know, a value addition? And who are some of the players in that space? If you see early pilots that might be taking off, it said few, it didn't say none. So, you know, who is perhaps piloting some of these early innovations in data sales, and what does it look like?
Right. Thanks very much, Ben, and always good to see you. The product data services guys traditionally have focused on providing services to government. And so the purchasers of the data services have typically been government. So you see the big players like the Pharma Secure, the Sproxils, and the mPedigrees. You know, they've provided mobile authentication services, for instance, the Scratch thing. And so they are the biggest, and they are well connected in government channels, at least in Nigeria. I don't think they're strong in other countries. Now, the ones that are coming up is that data is being produced routinely, whether in the consumer-facing side or in the provider-facing side. And you see companies like mPharma, for instance, now that are now, you know, actually developing a product that is helping the users of their POS systems, the pharmacies, better understand their trends and better optimize their procurements and their sales, avoiding wastages and, you know, all those kind of things. The other area where we're seeing it is when you see the marketplaces. There are many marketplaces that are allowing multiple suppliers to come on. So the opportunities are there, but there needs to be a more structured approach to, you know, getting this data. And one organization that is pushing a lot for that is MyShaMeds. MyShaMeds did a study recently, Dan Rosen, and they showed, for instance, the disparate up to 7 or 8 different data sources. So IQVIA, a company by disclosure, I used to work with IQVIA, is the giants in this area, right? But you see some gaps in countries like Nigeria and Ghana, where the data is not available. But IQVIA data helps in almost all the other areas. But you have import data, apart from in-market data. You have the patient consumption data. So integrating this, we're advocating for a pharmaceutical data platform approach. And this is something that we believe that organized sectors, you know, the Alliance, the Gates Foundation, and others can push for. That pharmaceutical data platform approach should be something systemic so that people are not procuring on just a need basis, but there's a systematic approach to collecting, to analyzing, and to selling this with a trusted, holder, or shall I say manager. I think there's a phrase Prashant uses for that, an intermediary of sorts that is trusted by both public and private sector. So those are some of the approaches we think we need to look at a lot more now.
Okay, Remi, I'd just like to add that from the innovators, from the perspective of the innovators we spoke to, they also recognize the value of the data some of them carry, but they had some concerns. First being around data privacy concerns, because in these focus countries that we did our study on, some of these countries do not actually have data privacy rules that can guide how data is shared within different companies, even with the public sector. How do they mention data? How do they manage data confidentiality of their patients? So that was a key concern that they raised during this process, because there was a specific question we asked them regarding their ease or willingness to share data with other public sector agencies and with other private sector companies. Another concern they raised regarding their ability to enforce or be able to make data sharing a viable business opportunity for them was, as Remi mentioned earlier, funding. They will need access to funding to be able to test the models that work, either in partnership with the government or with other key players along the supply chain. So those two concerns were something our innovators raised.
All right, fantastic. Ben, is that good to go?
Yes. Oh, sorry, too many buttons there. Yes, thank you. Appreciate
right.
the feedback. And Remi, I forgot you were at IQVIA before, so this is thank you.
Fantastic. Yes, and yeah, the issue of data is an interesting one, and maybe an area where regulation could play a role to make sure that we're protecting consumers and there's integrity in how people who want to generate money from data are operating. So yeah, Chelsea, you're next. Go ahead.
Great, thank you so much. I currently work at Cepheid, a diagnostic company that has the Gene Expert, but was previously at Gilead. And I am just curious to ask the panelists and the broader audience, what role you see sort of these trends playing and also increasing diagnostic access. And I was just on the MyDAWA website and saw that you can actually order HIV self-tests. So curious to hear, do you see that increasingly becoming an offering through these platforms, but also, is there opportunity to leverage sort of the brick and mortar pharmacies and drug suppliers to do testing there and then partner with, the right treatment, basically a test and treat model. So companion diagnostics and then putting someone right on treatment right there.
Yeah, thanks, Chelsea. The very interesting aspect of that is you have the policies, for instance, like in the malaria elimination program, testing before treatment is a key requirement. And these digitally enabled platforms, you see some of the innovators that are building it in. There's an organization in Nigeria, for instance, called Wella Health. Wella Health does a hybrid of microinsurance, and it's addressing one of the reasons why testing is not a common process. The cost, because almost everything is out of pocket, right, for most people in these countries. So what that innovator has done is to build it into one same premium, a $1 kind of premium almost, where testing is incorporated, and if drug treatment is required after that, it is at the same cost. So those are some of the models they're doing to ensure they build it in. And if we go to how findings are funneling into the investing in innovation program, it's now expanded beyond medicines to incorporate other products, like you said, medical devices and other things, so that the innovators are encouraged to expand their platform. Some of them already are doing that, like you saw, with the example you gave, but it's going to be institutionalized now in the incentivization that the focus would no longer be just on medicines. It was important to start with the biggest, part of the medicines, vaccines, and technologies is medicines. And now it's been expanded under I3 program to include medical devices and similar consumables and things.
And I'll just add that for a lot of the D2C digital first startups, I think for most of them, that approach or that thought behind ensuring that they have multi-service offerings is something that they all consider. So hardly do they just start up and focus on distributing drugs only. They have other service offerings, including teleconsultations, at-home lab test delivery. You can order lab test diagnostics. So on their app, and you'll get it done. An innovator like Rocket Health in Uganda actually acquired a laboratory diagnostics to ensure that patients or consumers are able to follow through from diagnostics to teleconsultation to product ordering and delivery on their platform.
Fantastic addition, Dunni. And the comprehensive and multi-channel, there was a question about the multi-channel approach. We're seeing that, and that's one of the reasons I think Dunni mentioned that it's difficult to compartmentalize the categories as purely providing digitization to consumers, providers, and product data. Many of them are starting to offer end-to-end. So the example of telemedicine is one where you start from a value proposition, but to keep the customer efficient and all of that, you then add other services until it becomes end-to-end. And the retail pharmacy players, for instance, are developing digital channels. So you're having both brick and mortar as well as the digital. But more interestingly is also those who started as asset-light digital first channels are recognizing that disruptions in supply chain leave them very vulnerable. So many of them are now investing in the infrastructure and the logistics capabilities of physical facilities. They also use it as an opportunity to test their value propositions, test their iterations, so that hybrid of omni-channel is starting to become a thing.
All right, great. So we only have time for one more question. And I can see Obiora has put something in the chat. So would you be interested in, unmuting and maybe asking the question directly?
Yes, I hope you can hear me. Can you hear me?
Yes,
okay.
Yes, we can hear you.
Yes, Obiora, we can.
Great. So I'm trying to ask, the focus countries were limited to just 4 out of all the countries we have in Africa. So is there any plans to expand that scope in future reports?
Yeah, one of the things, thank you, Obiora. One of the things we think this multi-year longitudinal study has afforded us is focus on something and study that well to then allow learnings to apply to others. So in the Investing in Innovation program, where 60 innovators are being, going to be selected for grants of $50,000, each for that 24-month period, is now Pan-African. So it's a fully African initiative. So you have North Africa, and you have a commercialization partner based in Morocco that's going to coordinate that. You have Southern Africa. South Africa was initially in the 2018 report, but it was excluded afterwards because they are far more advanced. So they're always outliers, compared to the remaining of sub-Saharan Africa. But now with the Investing in Innovation, the Southern African countries are also covered. And in West Africa, we noticed that another exclusionary trend, which is Francophone, West Africa. They have the least funding going into that. So that's going to be prioritized as well in the selection process. So fully Pan-African now in the Investing in Innovation. And the last part of it that ties it together is that this market intelligence work will then be more closely integrated with the Investing in Innovation. So in terms of scope of countries, that's likely to also see more coverage.
Interesting. Thank you, Ian.
Thanks, Obiora.
Oh, all right, thank you so much. Yeah, and it's great to hear that there's further investment in the landscaping efforts in other settings. I think this market intelligence is crucial in order for the market to be shaped in the right way and to continue to thrive. So the great work you're doing is appreciated. So I'm going to pass on to Sarah to close us out. Thank you.
Thank you, Martin.
Mhm.
Thank you so much, Martin and Remi and Dunni. This was amazing. And thank you all in the audience for your really very, very interesting questions. And it's a great, rich discussion. And maybe we'll even have a part 2 coming up soon. So we just wanted to thank you all for joining us. Please go to bayareaglobalhealth.org for more events and more conversations. And thank you too for the amazing findings and research that Salient Advisors did in putting this market intelligence report together. And we look forward to hearing more and continuing this relationship and this partnership. So with that, I'll give you guys a couple extra minutes to go get another cup of coffee or something else if it's a little bit later in your time zone. And thank you again for joining us. And we hope to have many more cross-sector conversations like this to really look at how we can come together to advance global health equity and innovation. So thank you all. Take good care.